I still think it's really important that if you have a voice, to use it. There can only be change when people are speaking up about an issue.
Today I'm joined by my good friend, fellow GP and Embarrassing Bodies co-host, Dr. Tosin.
Your first day, you are expected to be on the ward, taking care of patients and knowing what to do.
Baptism of fire.
I wasn't coping at the beginning. I wasn't looking after myself. Had it been a really busy shift, had I lost a few patients? I remember one day after work pretty much having a breakdown in my car.
I would say it's not even a job, it's like a vocation.
If you really want it, you will persevere. I learned so much that year. I built the confidence that I needed to be the doctor that I am today. For me, representation and putting myself out there is really important because it shows people that actually you can be a doctor. It's difficult to be what you can't see. Being able to use what I've learned and my knowledge and my expertise to help people on a wider scale, it's exciting, but it also just feels, that you're really making a difference.
Hi, I'm Dr. Jane Leonard. I'm a GP and cosmetic doctor, and this is my podcast, The Confidence Clinic. Every week, I'm going to be sitting down with different guests to talk about their life stories. We're going to be talking about how they got to where they got, the challenges they faced along the way, and how their confidence has evolved along their journeys. Hi guys, welcome back to the Confidence Clinic. So today I'm joined by my good friend, fellow GP and Embarrassing Bodies co-host, Dr. Tosin. Thank you so much for joining me.
Thanks for having me.
It's great to see you again in this context as well, a bit different from what we're used to, even though we're on a sofa again.
Yeah.
So what we normally do, or I like to do, is kick things off by looking back, reflecting and rewinding to when you were little, just because we're talking about confidence, how it builds and evolves with time as you grow. So that's a good place to start maybe. So what was little Tosin like?
Oh, that's a good question. I think I was definitely shy. I was quite quiet around external people. When it was my immediate family, they would probably say opposite. I was very cheeky, very boisterous, but anywhere outside the home, I was quite shy and quite quiet unless I became comfortable around you over time. So yeah, slightly different to how I am today. I guess I'm still a little bit reserved, but I'm definitely not shy anymore.
Yeah, it's funny, isn't it? I feel similar as well, that when I was younger, with things you were familiar with, you really kind of just rule the roost a little bit. But then in other situations, maybe it's just a characteristic of being a child in that setting. So when you were younger then, as you were growing up, so maybe sort of skipping forward to your teenage years and we're looking towards making plans for the future, because that's how early you've kind of got to do it when you're at school. So you went on to medical school like I did. But looking back to that time, did you have any role models in particular that you can think had like a really important role in directing you?
Yeah, I wouldn't say a role model in particular when it comes to medicine or being a doctor, but I think just in life in general, definitely my parents, 100% my parents. They came over to the UK from Nigeria shortly after they had my sister. So my sister was a few months old, and then they had me quite quickly after. And they had to pretty much start from the beginning. They had to start their careers all over again. They were both pharmacists in Nigeria, had to retrain here.
Oh, did they have to retrain as well?
Had to retrain. So my mum sat her exams when she had basically just given birth to me. I think I was 2 months old, and they had to go up to Sunderland from London to sit their pharmacy exams. And, I've just had a little baby.
I was good,
And the thought of doing that, the thought of sitting exams a few
particularly
months.
those exams. This isn't just like, this is like a massive exam after 4 years. Oh, it's 4 years, isn't it, for pharmacy?
Yeah.
I think it is.
Yeah.
I mean, that's no small challenge, is it?
Yeah. So just seeing what they've done and what they've accomplished whilst bringing me and my sister up. And, growing up, we never lacked anything. They worked so hard that they afforded us such an amazing life, So I didn't really see, the effort that they were putting in, the sacrifices that they were making, until I'm now older. I am a wife, I'm a mother, and I'm realizing actually it's hard being an adult. And now looking back to what they must have been going through, they were 100% my inspiration. They just made sure that I had everything that I needed and had everything that I also wanted as
Yeah.
well as a child. So it was a happy childhood. And I learnt the importance of hard work from them as well. I saw them working hard throughout my childhood.
I think as well, when you think about that, the story of your parents as well, like as the age that we are now and all the different things that we're doing, we need support around us as well, from whether that's family support, relationship support from friends, work colleagues. So imagining coming from a new country, having two new babies, so that's a new experience, settling in as a couple where they don't have that support system. They wouldn't have the parents here. So it's not like my mum and dad, when I was getting brought up, my mum was a teacher, so she was working really hard, and as was my dad. But my grandparents played a big part in my upbringing because they facilitate my mum and dad being able to work like that. Well, your parents wouldn't have that. So even the little things now that I certainly take for granted, it's only over time that I realise how much I rely on sort of my family and friends and wider support group, that without that, with all the challenges of being somewhere new, it's amazing, really, isn't it?
Yeah, no, 100%. Literally, they are my role models, and my sister as well. You know, my sister's only 18 months older than me, so we're pretty close in age.
Yeah.
But I think just the fact that she went before me at every single thing, it made me feel like I could do everything that she did. And luckily, or fortunately for me, she was amazing at everything. You know, she was smart. She was amazing at pretty much every sport that she did growing up. So it made me feel like, okay, if she can do it, I can do it.
Yeah, so you could follow her lead.
Exactly.
Definitely. Amazing. So then think about it. So when we were thinking of uni, we're at the age of 17, I think, aren't we, to make that decision, of that massive decision of where to go in life. And I know when I think back to that time, because I'm from a family where I don't have any medical influences in my life, kind of loosely through my dad. He's a scientist, but at that age, at 17, when making those decisions, I look back on that with real gratitude, because I made the right decision and luckily stuck it and made at it, you know, through medical school. But I didn't have any direct inspiration or someone to follow, really, other than the fact that it sounded good and I could just about get into it. So I did. But what about you? When we look back to that time, you're doing UCAS form, you're choosing potentially the rest of your life. You don't think of it like that, but you are. Can you remember how you felt and what sort of guided you to making that decision to do medicine?
It's interesting because, you know, if you ask my parents, they will tell you that I wanted to be anything and everything, probably but a doctor at one stage. So it went from wanting to be a fashion designer to wanting to be an interior designer to I wanted to be in the army at one stage.
Really?
I think we had the army come into school and give us a talk. And then I got home and I was just like, Mom, I want to be in the army. I made her enroll me in army cadets.
Really?
I was in army cadets for a good few months. And then I realized that, this is not.
Yeah, that would be too hard.
This is not my calling. So luckily, I think, you know, it was luckily a teacher that suggested that I study medicine, or suggested that I look into it, because I enjoyed biology and the sciences, and because I enjoyed it, I worked hard at it, so I got the good grades. So a teacher said, "Oh, how about medicine?" And I hadn't really thought about it before. I hadn't thought about becoming a doctor, but I did a work experience in a local hospital near me, and really the rest was history from then. I found it exciting, and the fact that you could help people literally every single day. I was like, okay, this is the job for me. And then I applied to medical school. I can't remember that whole period. It feels like
it was so stressful.
It was very stressful.
Very stressful.
I remember it just felt like this was the be all and end all.
Yeah.
It felt
I
like
remember
you
that.
had to get into university and you had to study medicine. And if you don't, your life is over.
And the way that they really do put an emphasis on that you're lucky to be there. Because I feel like that now. I feel like, you know, look, there are many sort of pros and cons to the career that we'll come to. But certainly I feel like it's a real privilege to be allowed to learn all that vast education that is like life and death stuff, all the way that it's how your body works. It's all about the medications, to all about the different illnesses, all about how the infrastructure of hospitals almost work. But that feeling of like, I think, isn't it like a very small percentage only get in?
Yeah.
And they make sure you know that.
Yeah, 100%. So you're filled with so much anxiety from when you decide you want to study medicine to when you then apply to the universities, to when you're sitting your A-level exams, to when you're waiting for your results, or, and then going for the interviews at the universities. It was just, it was a tough period. And I have a funny story. I remember I went to, I really wanted to go to Manchester. Manchester was
that's where I went to.
You didn't?
Yeah, Manchester Uni.
Did you?
Yeah.
Did
I can't believe I got it over you.
No, I got it.
Oh, right, okay. That's what you were going to say. No. You didn't get it. I was like going, oh, that's weird.
No, I
did.
Thanks. It was my first choice, and I wanted to go there. And Birmingham University was my second choice.
Right.
So I had universities. I had interviews for both universities, but they were both a day apart. So I went to my Manchester interview, felt like I did well because I really, really prepared for both.
Yeah.
Next day I went to my Birmingham University interview, and they asked me in the interview. So it was 4 people sitting on a panel and me in front of them. So you can already imagine how daunting that is.
And didn't we have to wear like suits and things?
Exactly.
We were really young. I was like, looked like a proper little kid.
Same.
And I'd like a big suit on that didn't even fit me.
Same. I mean, you can only imagine what those interviewers must have been thinking. So I was sitting in front of this panel, and they asked me, why do you want to come to Birmingham University? And, I had prepared so much for these interviews. So I was like, perfect. I know the answer to this question. So went on my spiel about why I thought Birmingham University was great, why I thought it was for me. And then after about a good couple of minutes, one of the interviews stopped me and he said, you do realise you're in Birmingham? I'm like, yeah. He's like, you've been speaking about Manchester for the past 5 minutes. And I was like, oh my gosh. I just wanted the ground to swallow me. But they still gave me a place.
Yeah, well, exactly. Because
it shows that you're human at the end of the day. And
it shows as well in that situation. I think they make those interviews really tough in retrospect because the job, a lot of it, and you go from being, I think when I qualified, I was 23, so I went straight into A&E, having difficult conversations, dealing with people in life and death, literally doing that. Going in one day, you're just a beginner, the next you're doing the role that were essentially, obviously we're more seen in that now, but it is a bit of a leap of faith. So I do think that part of that process does sit in line with the sort of person that you need to be in order to handle the pressure. Because even though it's not an equivalent pressure at that age, at 17, when that's all you want, and they find out as well if you want it or not, because if you can't handle that and don't want it, you just like, forget it, I'm not doing that.
Definitely. And I think, I don't know about you, but there's been so many stages during, medical school and my career as a doctor that I could have been like, do you know what, this is too much, this is too hard,
Definitely.
I don't want to do this. And there probably were stages that I felt like that, but if you really want it, you will persevere, because medicine and being a doctor, it's definitely not easy. It's not
definitely. And for good reason, I think. And I think it's normal to go through anything that is, it's got amazing highs, but the highs are high, but the lows are low, right? Mm-hmm. And I think I would say it's not even a job, it's like a vocation. Yeah. Like many things you can't, it's a certain type of person to do it and stick on the kind of roller coasters that it brings. So perfect sidestep now. So we've got into medical school. So we both went to the same one. I do remember that, actually.
Yeah, I do. Now I remember.
Yeah, now I remember.
We actually both went to Manchester, just at slightly different times.
Yeah, different times, yeah. So that, for me, was an amazing experience. And I think going from a small town to a big university like that, not only just in the University of Manchester where we both train, but there's at least 2 other unis that are there. So the actual experience of being in a place like that with all that expectation and excitement and opportunity really sort of filled me with so much ambition.
Yeah, same. I think it was an amazing experience. Manchester is, especially coming from London, because I knew I didn't want to stay in London. I always felt London will be there, and I just wanted a bit more of a university
and you definitely get that.
And you get that in Manchester. It's a work hard, play hard kind of city. Yeah. So obviously you're studying medicine, you have to work hard. But Manchester, you really get the opportunity to play hard.
Yeah, it was really
fun. A lot of fun. I definitely would say those are some of the most formative years of my life.
Yeah, it's same, definitely. And so much so, I did an extra year. I did, you can do an intercalated degree. I was like, there's no way I'm leaving this and going to work. Okay, we'll do another degree.
See, I didn't think of it like that. I thought of it, even though I really, really enjoyed my university experience, I just wanted to become a doctor as
Yeah.
quickly as possible. So I was just like, I don't want to do another degree because
I mean, it
that
didn't really
would...
make any difference.
Well, I don't know. Looking back, I would say that it would have probably been a better decision for me.
I think at the
There's no
time,
rush
yeah.
to become a doctor. There's
Yeah.
no rush to
Yeah,
start
yeah,
working
no.
and become an adult. And it's a lot of hard work. So I would say, looking back at my younger self, I would have said, you know, take a break at
Yeah.
some point, whether that's, you know, before you go into university, taking a gap year or taking a year out after, you know, foundation training, those first 2 years
Yeah.
when you become a doctor, to just, you know, relax a little bit, because once you start working, I was going to say it's all downhill from there.
Yeah.
It's not all downhill from there. It's a great experience, but it's hard work.
And I think that is really good advice, because I definitely think that when it's all about sometimes, when you were at university, I definitely did live in the present moment there, because I was loving, like you say, the learning this amazing, it's like this amazing box of skills essentially, and the privilege to learn medicine in one of the most sort of elite and established places. Lots of friends, you know, amazing sort of nightlife and university vibe. So he's very much in the moment of that, but you're still striving to try and reach for this goal that seems so far away. So you're still always thinking about the future. And I think that's good advice, to actually have a moment going, the thing with that is, and the thing actually what I'd say medicine is like, is very much institutionalized. Life does go on without it. But when you're in that, you're like, this is the only thing. And you've been feeling like that since you were 16 or 17 preparing for it.
Exactly. It's a very much conveyor belt system.
Yeah.
So it's like you get into medicine, you have your 5 or 6 years at university, then you become a foundation doctor, you have your 2 years doing that. And then they push you to then decide, okay, what do you want to specialize in?
Yeah.
So for us, we went into the general practice route. So then you have another 3 years.
And that's intense.
GP, and that's intense. So it's just, you know, it's this constant jumping hoops, this constant exams, and then you finally get to the end. You finally
you're like,
GP, and you're like, okay, so what do I do now?
Well, you carry on.
You carry on, but I think for me, when I became a GP, I kind of missed that always having to prepare for something.
Yeah.
That
It's
always
quite, I found that hard to cope with a little bit, because you've always got a structure, you've always got like a roadmap in front of you, and there are pressures of that, of where you should be going, but there are ways there that reassure you that you're on the right path. But with this, and probably as we'll come on to in our conversation about the variety of things that we're doing, and a lot of the things we do now independently, that is something that I'm only just now feeling better about my work. And that, funnily enough, is now because I've become more successful in my career and working with different people that indirectly give me that support. But so let's look back then at the junior doctor years, because they were I'd actually say they were my favourite.
Interesting.
I worked at a place called, I worked in Bolton Hospital, so it's a district general hospital kind of in between, so it's in the northwest, in between the main sort of massive tertiary centres in Manchester. So it's a place where it was extremely busy, but you got all the emergency cases and the overflow of these hospitals. But the thing is, with the bigger hospitals, you've got a bigger team. There you were still quite a skeleton staff, so you would really have to take on a role. It was a bit of a baptism of fire.
Yeah, I had a very similar experience. I think, so what happens, for those that don't know, once you've finished medical school, you are ranked with everyone else in the country that's finishing medical school.
Oh God, yeah, are you?
Yeah.
I forgot that.
And you have to apply. So you also...
I don't think they were doing that when I was there.
Really? So you're ranked with everyone, well...
God.
When I finished, you were ranked with everyone that's also completing medical school at that stage. But you also have to rank where you want to go.
Oh, actually, they
And you
did
have
do
to
this,
rank
yeah.
everywhere in the country. So unfortunately, I probably wasn't as smart as Jane at this point.
No,
And I didn't get my first choice. So at that point, I wanted to come back to London.
yeah, and that would be the most big competitive place.
So I was like, okay, I'm ready to come back to London. I'm ready to be close to family and friends. But unfortunately, I got my next choice, which was West Midlands. So not terrible. But then I ended up in Shrewsbury, which is a town just about an hour outside of Birmingham. And I'm a city girl, you know.
Yeah,
London, Manchester, I want to be around the buzz. So I was like, I remember being really upset. I remember crying when I got when I got Shrewsbury. I'm like, where am I going? I have no idea where this place is.
And it is
And
isolating because it's
yeah,
probably the most high pressured, lonely. I mean, I can't even think of the words to convey how hard it is, and you're
yeah,
so young.
it's really difficult. You know, you're like you said, you're by yourself if you're not in a city where your family and friends are. You're starting this new job as a doctor, straight out of university, straight
Yeah.
out of medical school. I was in a very similar situation as you, where it was a district general
Yeah.
hospital. So you're not in one of the large hospitals. You're in a small hospital, but yet the workload
The workload is more,
is
and you
huge.
are like, when you're still like, I'm still a house officer in the big hospitals. I don't know, you're still like a medical student. Whereas there's right, there's a ward of patients, and what do we do with them? And I'm like,
Literally, your first day, you are expected to be on the ward, taking care of patients and knowing what to do. So it was definitely a huge
and
shock
you'd be
for
quite
me.
alone there.
Yeah, definitely. I think in hindsight, similarly to you, it was probably some of the best years of my career because I learned so much in that
Yeah,
year. I
I
definitely,
absolutely loved it, but in a way that it was a good job. It was only 2 years, because
yeah,
any more than that,
yeah.
that's it.
Definitely would have been too much. But
Yeah,
I learned so much that year. I probably built the confidence that I needed to be the doctor that
yeah,
I am today, to be what I consider a good doctor.
yeah,
I definitely built most of that in that first year of being a doctor. And I made some of my closest friends to this day because we were all there in the same situation. It's like the first day of school or the first day of
yeah. It
university
is. Yeah,
again. You're all in the same situation. So you all bond together, you all support each other. And I've made some last
yeah.
lifelong friendships from there, which is absolutely great.
What were your like sort of moments looking back that there were the real sort of high moments, or moments that you made you proud? So the few that I remember were you you sort of like, I don't know, handle situation that you didn't think you could, or create relationships with patients, or things that you know you'll remember. Can you remember any of those?
Oh, it's really difficult. It all feels like a bit of a blur. But I
Yeah,
think, the first time that you do everything, essentially, the first time that you, um, even see a patient in A&E and manage them from start to
yeah, that was my
beginning.
first ever patient in A&E with heart failure.
Wow.
And I'm like, right, let's get the control drug cabinets out. And
Yeah.
you're like, but you think of that now.
And the first time you go to a cardiac arrest
Yeah,
and you are one of the first people at that cardiac
yeah,
arrest and you are managing that cardiac
yeah.
arrest. All
I
of
don't think I
those,
could do that now. I could do it,
you definitely could.
but not with the boldness that I would have done it then.
Yeah, I agree because at that stage you were as a junior doctor you were expected to be one of the front people at the
Yeah,
cardiac arrest. You were definitely sometimes one of the first people, so you had to have that confidence. You
yeah,
didn't have an option to shy away
yeah,
when someone is there,
yeah,
on their
exactly. Yeah,
deathbed. You have to step up as the doctor. um and because we don't do it so much now,
yeah,
being in community as a GP, and obviously we do lots of other things outside of
yeah,
our clinical work, we probably wouldn't have the same
yeah,
confidence that we
exactly.
had
It's
back
funny, isn't it?
then.
And then that leads into, so I think one of the most challenging things, though, that I'm proud of myself for developing the confidence in, is in that setting. Obviously, we're talking about the actions that we have to carry out when something terrible happens. So somebody comes really unwell, or in fact has a cardiac arrest, or in fact passes away. But then the other thing that goes alongside of that is we are the messengers often to break this bad news. And I remember we all would have got the same training, particularly for you and I at Manchester, the communication skills day, where we kind of have to basically broach these difficult subjects in a compassionate way, but also in a way that kind of gets the point, gives a message in a clear way in moments of madness and often deep upset for everyone.
Mm.
Can you remember any of them?
Yeah, definitely, definitely. And I think when you're in medical school and they are teaching you how to break bad news, it almost felt kind of weird. It's like,
Yeah,
we're human, we can communicate. You don't need to teach us this. But actually, when you are in that
yeah,
scenario and you have just been, back to back on an 8-hour shift, or you've just finished a cardiac arrest and you have a million and other things going on.
And then you're being pulled going, but you need to speak to the family.
Exactly.
And you're just like, and that they're the times I think that you do almost reach your back pocket and remember how to do it. Otherwise, just going, well, what like, and I think that is something I probably still use now.
Yeah, 100%. I think you need to disconnect with everything else and just focus on that family, because for that family, you're about to tell them the most devastating news, and you might have had time to process that. You might have known the patient before, you might have been in that cardiac arrest, but this family, that's their loved one.
Yeah.
So you have to be so sensitive in that time. And you pull out from your back pocket all those things that you've been taught, your years of experience.
Yeah.
And it's not easy. I would say, no matter how many times you do it, although you are the professional and you've been taught how to break news, it never gets easier. It's definitely difficult.
I think definitely looking back on that now, I think doing GP work now, because you do less of it, and when you tend to do it, you tend to be talking about diagnosis, don't you? Like some results, or in that setting, there's nothing like it, I don't think, in the hospital, because it's where all the action happens essentially, and you're so programmed to be like a little machine doing all the tasks and actually carrying the weight of it all. But bizarrely, because you're with a team of people also going through it, and like I mentioned before, this idea of like you kind of institutionalize that that's nothing else in the world is happening except what's happening in that hospital right now. And that's what I suppose, that the support from colleagues, everything makes such a difference. So just thinking now then, that looking back on that, how did you cope with it all personally?
It's a good question. I think at first I probably wasn't coping.
Yeah.
I think at first I was just, just taking every day as it comes, just going through the motions, being really busy on the wards, sometimes forgetting to eat my lunch, sometimes forgetting to use the toilet.
Yeah, drinking water. I never used to drink any water.
Exactly.
I just used to eat celebrations on the ward. I just used to eat packets of celebrations in my school. So like, yeah, let's have a handful of them. And then, a sip of water, and then we're off again. And like all these packets of celebrations and like patient lists coming out of pockets and the bleepers going. You can imagine, can't you?
I mean, but it's so easy to just fall into that and live an unhealthy lifestyle whilst you're working in the hospital, and whilst you're working shift work, especially going from nights to days. And I hope they've changed things in hospitals now, but having vendor machines just full of chocolates and crisps, that's the only thing you can get at 2 a.m. in the morning.
Yeah.
So I wasn't coping at the beginning. I wasn't looking after myself, and then I wasn't processing what was actually happening in hospital, what had actually happened that day. Had it been a really busy shift? Had I lost a few patients? Had I struggled with something at work? I wasn't processing everything that was happening. I was just going through the motions. So I remember one day after work pretty much having a breakdown in my car and just being in tears.
That's the thing, you've got to drive home after all that.
Exactly.
If the shift's 12 hours, it's supposed to finish at 8 a.m. It doesn't finish at 8 a.m. Finishes like 11 a.m.
Yeah. Exactly.
And then you're cozy knack, and then you got to get. I used to have to drive like an hour on the motorway.
Wow, and that's so dangerous. It's so dangerous. And I was doing the same, because remember I said I ended up in Shrewsbury, and
when you finish your night shift, get to London.
I was kidding myself. No, not that bad. But I was kidding myself, and I said, well, I want to stay in Birmingham, because that's what I knew. I at least knew Birmingham a little bit, but it was a good hour's drive, if not more. So after a night shift, I was driving an hour, and it just took its toll on me after a while. And I was like, I can't continue doing this. So I packed up from Birmingham and moved closer to the hospital, and it just changed my life and made things a lot easier. And I just realized that I needed to go back to my coping mechanisms and start looking after myself. So for me, that meant, going to the gym again and playing netball, and actually making sure that I take time to spend time with my friends and family. So once I started prioritizing those things outside of work, I actually started functioning a lot better and being happier at work, and probably treating my patients and my colleagues better.
I think that is really good advice, and that's a realization I came to as well. a life goes on outside the hospital, and because it's all consuming, and because it does affect you in so many ways, and like even in terms of you don't have a chance to choose what you want for your lunch, or when you can take your lunch, or how many drinks of water you're going to have when you go to the bathroom, or like all of those things. It's a never ending thing, and unfortunately as well, you don't really, so everyone's in the same boat. No one's really looking over your shoulder going, Tosin, have you had your lunch, or can you make sure, did you get a chance to do that, do you need any help with that? Because everybody's frantic too. It certainly was where I was. And I think that's really good advice, that it's really important to try and make the time to do the things, to remember that you're Tosin and not just Dr. Tosin all the time.
Definitely, 100%.
Have you got any other tips then, just thinking of anyone, junior doctors or anybody getting into medical school or anything aligned to it, because it's not just doctors under that pressure, of that, like really good practical tips, because they're good at actually specifically go and play netball, do your team sports,
Yeah, I would say at the end of the day, it's just a job.
Yeah.
It's not who you are. It's not your identity. It's part of who you are.
Yeah.
But it's not your whole life. And I think you have to remember that. And, you know, for instance, when it comes to taking time off work, everyone's entitled to take time off work. Everyone's entitled to have their annual leave. But sometimes that can be really difficult in the hospital. Because
I remember,
the rota is so intricate.
Oh God, that's another thing to add into the mix, the bloody rota. Forgot about that. Yeah,
it's horrible.
Swapping shifts.
It's horrible. So when it comes to you wanting to take time out, whether it's to go to your best friend's wedding, whether it's to go, you know, just to have a break for yourself, the pressure and the anxiety around that.
I've had a moment of gratitude thinking we don't have to work with that rota anymore.
We don't.
Gratitude, the bleep's gone and the rota's gone. Thank God.
But the pressure is horrible. And I think you just have to remember actually that you are entitled to time off work, and it is for the hospital or the institution to, you know, cover you. It's not, you can't feel bad when you're away from work, because that will take its toll on you. So just remember that, you know, your job isn't your whole life. Secondly, ask for help.
Yeah, that's so important, particularly because it's not just about, that's one thing I definitely was never sort of shy of or too proud to do, but not to the point that I was annoying. I don't think I ever was, but more that making a mistake is got so much at risk on so many levels, but it's not just like no one's going to care. And even if they do care, that's on them. You have to kind of go and say, like, ask for help, whether it's something clinically or something personally.
100%, definitely. And I think I also learnt that early, and I think that was definitely my saving grace. The people that I saw, my colleagues that I saw struggle a little bit more, were probably the ones that felt they needed to do it all. And no one can do it all. No one knows everything.
And it's a career where it's lifelong learning. So it's embracing that, remembering that, and also you're only going to remember certain amounts of things that are relevant at that time. And actually, there's nothing wrong in kind of sort of saying, I need help on this, and then that the sort of chunks of knowledge or pearls of wisdom that you get on them will reinforce your learning.
Exactly.
With attachment of a practical memory that will really help it consolidate in your memory bank. Brilliant advice. So just sort of skipping on then to where we're at now. So one main things I wanted to talk about. So you and I have both kind of carved out similar but different careers, in the sense that we've done the GP bit, and I think the main bit that we've spoken about is the sort of action bit at the start. So you get to be in a GP, which we are now, and then you and I have both done things alongside it that actually make our career quite diverse. But I think particularly with you, I was looking at some of the things you're doing recently. So you still have a really active interest in women's health. You're doing an endometriosis event this weekend, isn't it?
I am, yeah.
That's amazing. And also then you do a lot of things more related to sort of the wider side to medicine, so breaking down barriers, more like cultural barriers, so supporting, not promoting, but raising awareness of the pressures of being a Black doctor working in the UK. Can you tell me a bit about that, and what brought you to want to do it? Anything in particular?
Yeah, definitely. I think for me, it was a gradual kind of process. I don't know if I set out saying, you know, I want to go out and speak about, you know, inequalities or disparities that we see in healthcare. But it was a gradual process that the more I started talking about health online, the more I started, you know, realizing the vast disparities there were, and people coming to me and talking to me about their experiences. And then I started to do more research, and then especially when it came to women's health, when you see the disparities or the inequalities in maternal care.
Yeah.
So we know
actually
that
frightening, isn't
it's so frightening. We know that Black women are currently 4 times more likely to die during or shortly after childbirth. And not so long ago, that was 5 times more likely. And we've known about these statistics for a long time. They're not new, but we're just really starting to talk about them, which is sad because we're just really starting to at least see minor changes because people are talking about them. But these statistics have been known for many, many years. And that's not the only areas that we see inequalities when it comes to race within healthcare. So I thought it was really important. I still think it's really important that if you have a voice, to use it. There can only be change when people are speaking up about an issue. And
even I think for the patients as well, knowing that, not only does doctors, but knowing that if you know, even just using the example of the maternity cases, that, you know, you're going through a massive change in life, pregnancy, a new child, you know, all of the pressure on your body at that time, knowing that you are at risk of something, so that at least you're empowering them as well as raising awareness to us.
Yeah, no, definitely. And I think on the other side of that, even in my day-to-day GP work, when I was a GP registrar, so during my GP training, I worked in a GP practice in Brixton, which is a heavily diverse community, quite a lot of West African people in that area. So I remember I would have so many patients coming to me being so excited that there was a Black doctor in the practice.
Right, okay.
Because it was a GP practice in the middle of Brixton, but there were no Black doctors there.
Really?
No. So they were so excited, and I kept having all these patients come up to me.
They all want you, and you're like, this is
all
like,
wanted me.
This is a blessing, but like, I'm only me.
Yeah, it was a nice feeling, especially having the older patients. You know, they say how proud they are of you, and for me, that just reinforced, you know, the need to see more Black doctors or Black healthcare workers across
and also
the board.
for the patients as well, forgetting that it puts obviously pressure on you there and then, but also it does leave you thinking, what were they doing before?
Yeah, no, definitely. And I don't think as a patient you need to see a doctor who is the same race as you. However, you need to see representation in the areas that you are, in the areas that you live in, because that is the society that we live in today. So I think it's really important to know that there are, you know, Black doctors, Black nurses, Black professionals, and there definitely are. We are out there, but we live in London, so it's a little bit of a skewed bubble because we see, you know, Black people in the healthcare workforce to quite a large extent, I would say. But once you step out of London, that's not necessarily the case. So I think for me, representation and putting myself out there is really important, because it shows people that actually you can be a doctor. You can be a doctor who's doing other things. You know, I'm a big believer that not necessarily that you can't be what you can't see, but it's difficult to be what you can't see.
Yeah, of course. So I think that leads in nicely to talking about embarrassing bodies when you and I met. And that definitely for me, obviously it was like a dream come true to do that. But it didn't come without its pressures, in the sense that I'd never done TB before, and putting yourself out there working it was I found quite challenging, nerve-wracking. Also character building now that we've done it. But also going on what you're saying in terms of representation, you doing that is really, you know, something to, well, I'm not saying something to be proud of, but it is. Because what they're saying, that you, looking back to when I said to you at the start, do you have any role models? If you say you did want to be a doctor as little Tosin, there wouldn't be anybody that you could say, I want to be like Dr. Tosin, yet now you are Dr. Tosin. That is
exactly.
So that's quite amazing, really.
Yeah, and that's pretty much one of the big reasons why I decided to do it. Because to be honest with you, when when I was offered the role to go on Embarrassing Bodies, it was really exciting. It was a dream come true. But then I don't know if it was imposter syndrome, but I also had a moment where I was just like,
I was like, what are we doing?
Yeah.
I was like,
why me?
I was like, why? But I was like, but what are we doing? And they were like, actually, I was like, but what? I was like, what do you mean? Like, go on, start. I was like, so, oh, right, hi.
That was definitely the both of us. I think Anand, who's done TV before, he was ready. I think the two of us were a bit
I was like, I think we're meant to go now, say something.
Yeah, I think we were a bit like, what did we sign up for? But I mean, it was amazing. And like I was saying, yeah, it was definitely one of the reasons that I decided to do it, because when I was offered the role, I thought, is this really for me? Is it what I want to do? Why me? So definitely some imposter syndrome creeping in. But then I had a moment, like you said, when I thought, actually, if little Tosin would have seen a black female doctor on TV, that would have been so powerful.
Yeah.
And I would have just felt that little bit more confidence in knowing that actually I can do what she's doing because she looks like me.
Yeah. And it's like your sister guiding you. Oh, she's off doing it, so I can do it too.
Exactly.
And I think even that indirectly, not even necessarily related to medicine, just something like that. Because I think for both of us, it was such an iconic TV show, and to do it. And I think as well, one thing that I'm proud of is that putting yourself out there, not knowing how it's going to be, how you're going to come across, but having the faith in yourself, even when you're doubting yourself to do it. Again, going back to what the purpose of this and podcast is and the intention behind it, is that part of confidence that I've gained in myself is putting myself in a situation that I wasn't confident in. And yet, if I'm in it again, like we are now, I'm kind of all right with it.
Yeah.
Things like what's the worst that can happen, or anything like, I mean, in that situation, there's loads of things. But I think,
we have our careers at stake.
I was like, actually, yeah. But I think, now moving forward, these things, when I say character building, there are things where it's taking risks, putting yourself in situations where you doubt yourself, but learning your own way through. And I suppose we had different ways of dealing with things, but I think it's more just taking, every day as it comes, and learning, reflecting, asking for help, all of those things. But have you got any tips then? So for anybody, because people often ask me, and I'm sure they must ask you, and again, this is when imposter syndrome comes in, because I'm like, I don't actually know what I've done specifically to give them advice, but to do a career in medicine, but more importantly, to make these sort of side steps that you have to create a career that's diverse and interesting, and means that you're learning, almost carving out your own career. Anybody who feels maybe stuck in medicine, or in fact stuck in any career, is there anything you'd advise them?
I would say don't be afraid to try something new. Like I said before, your career is not you as a whole. It's just a part of you. So don't be afraid to try something new, especially if you have a career like medicine. I think we're fortunate enough that we have something to fall back on.
Yeah.
We've worked hard for that, but we are now in a fortunate position where we have something to fall back on. So actually, I can say, do you know what, I'm going to try this. And if it doesn't work out, I'll always have a job as a GP. I'll always be able to work as a GP. Not everyone has that luxury, but I think even if you don't have that luxury, always have a plan B, always have something that you can fall back on. So if you try something, there's always something that you can fall back on.
That's really good advice, definitely. And I think, it is that thing of that balance, isn't it? It's really good to be bold and to be ambitious and to be spontaneous and kind of go, right, that's where I want to go, let's reach for the stars and doing that. But actually something in the distance takes many little steps along the way. And also there's, the way life is, it's not always that easy just to kind of, things are difficult and require many other things than just a dream to do it. So I think, that's good advice of actually definitely, looking to do what you want to do, but actually look more closely at the little steps it takes rather than the big leaps of faith.
Definitely. I would also say don't be afraid of failure.
Yeah.
I think people see failure as the end. So, if I fail, that's it, it's all over. But if you see it as a detour, it's just a different way of getting to the end, and it doesn't mean that it's all over. And often you learn huge amounts from failure. So just seeing it as a helping step and a detour to where you're eventually going to get to.
I think out of everything, and certainly what I've learned through medical school and all ups and downs and things of that, like, things do turn out, and all these, if anything goes wrong, so to speak, or doesn't go as planned, or you feel like in that moment, look, everything that I'd pinned on this has dissolved in a second, actually, you either teaches you something or redirects you to something that is more suited to you anyway.
Yeah, 100%.
So, yeah. And lastly, before we go, what's next for you?
Oh, big question. So like you said, I do a lot of work around women's health. Still working as a GP, but I'm combining a little bit more of that. I'm going into the world of femtech. So using technology to improve women's health and improve women's health outcomes. So that's going to be taken up a larger part of what I do. But I'm still doing everything else, still doing my talks,
sounds so
my
cutting
health
edge.
education. Well,
yeah, I'm like,
yeah, I think so. I think there's definitely, when it comes to healthcare and technology, I think there's a huge power to improve the outcomes of, people's lives. And that's hopefully what I'm going to be a part of. So that's definitely going to take up a larger part of the work that I'm doing, but still doing a lot of work on social media, talks, speaking engagements. So yeah, you'll still definitely see me everywhere.
That's the beauty of it, isn't it? That actually you with medicine, there are so many different things you do. You just got to get through those first hurdles. But as we say, looking back, they're never as bad as they seem. You do get through them one way or another.
No, you definitely do. And I think it makes life exciting. Well, for me, it does anyway.
Yeah.
Being able to use what I've learned and my knowledge and my expertise to help people on a wider scale, whether that's on TV, whether that's, with technology or on social media. It's exciting, but it also just feels, that you're really making a difference to as many people as possible.
You definitely are. And I think going back to what you said before about representation, and also just showcasing that it's not just many things can be done, and you're showing that, we've got this job, but the part of you driving it allows you to have these amazing kind of twists in the road that make your career so diverse and therefore your life exciting. And also you're opening yourself up to more possibilities.
Definitely, 100%. And maybe one day I'll slow down and I'll focus on one thing. But for now, I'm enjoying life.
Wow.
And
why not?
And I'm enjoying what I do, which is, I think, the most important thing.
Definitely. Thank you so much for joining me. It's so good to be back on a sofa with you.
It is. It is. We need to do another season of Embarrassing Bodies coming soon.
Oh, yeah, definitely. Thank you, Diane. Thanks for coming in.
Nice to see you. Thank you.